wave hitting the United States pummeled US markets over the last couple of days. And in India here, the conversation is a little different. We're still wondering where we stand as far as the numbers are concerned. But there are now genuine concerns whether this will be the end or the only version of the coronavirus we will see anytime soon. So what are the facts out there? The panic is to this extent that rumors started circulating about another round of lockdowns. Some state governments like Maharashtra have come to the fore and clarified that these are right now just rumors. But let's get our facts straight first. So to do that, I'm joined today by Dhrubabrata Ghosh Dastidar, Director Data and Analytics at Protiviti India, and of course pleased to be speaking with Dr. Ramanan Laxminarayan today, Director at the CDDEP. Welcome to both of you, and thank you for talking to us today. Dr. Ramanan, let me begin with you. Now, first, can you explain to us what are people saying when there is a second wave? And in India's context, it's become a hot talking point because of the Nomura report, which has come out. It identifies 15 countries which are most susceptible to a second wave, and India is on that list.
Tamanna, the way epidemics work is that typically if we had done nothing about it, no lockdown, then there would have been a single wave which would have gone very high, and then a lot of people would have been infected in that first wave. We may still have had a second wave, but it would have been a different part of the country. And you have to remember, there is not a single wave for India. There is a Maharashtra wave that's different from Kerala and different from Tamil Nadu and so forth. But as far as the epidemiology goes, if you control the disease in very early stage, like was done with the lockdown here, then you have a smaller first wave, and there's also a chance for a second wave. So this is what we know about how epidemics actually work. I think it's too early to talk about a second wave for India. We are not even done climbing to the top of the first wave. We then have to climb down from that first wave. I think this entire process, even for a state like Maharashtra, which was at the forefront of India dealing with the epidemic, is not going to be over till October probably, maybe even to November. So anything that you think about as a second wave is definitely not even a 2020 possibility. It's probably December, or after that we have to talk about a second wave. So it's way early to even discuss a second wave, right?
Okay, so then explain to us in the American context, because it's caused such a huge panic there. And in the US as well, we've not really seen as harsh a lockdown as in India, and we've seen a consistent climb in numbers.
The harshness of the lockdown is not the same as the effectiveness of the lockdown. So Sweden, for instance, everyone says there is no lockdown there. But, if people have spaced to distance and people are disciplined and compliant with the lockdown rules, you don't have to have a harsh lockdown. It's a very effective lockdown. In India, we've had a harsh lockdown, but not a very effective lockdown. And many countries have had a less harsh lockdown, but a much more effective lockdown. So I think let's talk about effective lockdowns. We clearly did not have one. In countries where it was very effective, it did bring the first wave down, and countries in Europe particularly are part of that, where they will undoubtedly have a second wave, and the US is also part of this. So the US is now seeing that, after that first wave was over, a lot of people went outside and mingled, and now they're going to see a second wave. In India, that's not the case. We could not have an effective lockdown. That's just the structure of our population.
Yes, but we have had an unlocking. Dhrubo, and that's the question. We've had an unlocking. We've seen about 2 weeks of an unlocking, in large parts of the country, some more stringent than the others. And then that's the concern. Is that going to lead to a rebound of cases? And call it what you may. Don't want to call it second wave. You want to call it a second peak or whatever it is. The concern is now that we will see more cases in areas of the country which seem to have got the situation under control. For example, in Kerala.
No, I agree. So it's very naive to call it a second wave. We are perhaps not done with the first wave. But what we see is as we go into an unlocking, the number of cases have started rising up. Places like Kerala, as you rightly mentioned, and even Haryana, we have seen the recovery rate going up and then going down, which actually talks about the fact that the more you are unlocking, the higher the jump in the cases are over a period of time. And that's definitely a cause of concern, because we are not able to go down the entire elimination of that particular virus in a particular state or city. That's what we have seen. Kerala is one. I would say in Telangana and Andhra Pradesh, we have seen the recovery rates going up. And then after a certain period of time, it's starting coming down. So which indicates that with the unlocking, there has been an adverse effect.
Okay. So do you agree with, the view that Dr. Ramanan has spoken about, that we are going to possibly hit the peak of the first wave, if you see as a cumulative, about September, October?
I wouldn't say September, October. Yes, we perhaps would hit somewhere around July, as per what we are seeing on the trend or the prediction. We have not run a recent report. As per the last one, it was somewhere around the beginning of July, right? So we would see perhaps a more elongated or a more delayed peak because of this unlocking. And we perhaps are looking somewhere around the end of July in this case. Yeah, but we are yet to run the report for the next cycle.
Okay, fair enough. Dr. Ramanan, then now let's come to how we have dealt with the situation. The first set of lockdown has had a huge economic impact, and we have spoken about that in the past as well. There seemed to have been no option but to start unlocking gradually. And now it has to come into effect. People have to find ways to live with the coronavirus. Doesn't this inherently come with a situation of more infections when we already have our health system coming up woefully inadequately?
So first, let me just correct something. I agree that the peak of the Maharashtra wave is going to be at end of July or early August. I still stand by that. What I meant was the end of that wave will be in September, October. So probably October or November. So there's a peak and there's an end. So just to clarify on that. Now, with respect to your question right now, undoubtedly cases are going to go up. This is, you have to start from first principles here. The fact is that this is a disease to which no one has immunity. There's limited ability of us to control this virus beyond the social distancing, which only slows things down. So the time that was bought has hopefully been used for preparedness, although is distressing to see that in places like Delhi, there's already utter chaos, even though we're not anywhere near the peak. So there are people being turned away from hospitals, testing has been reduced. There's undercounting of deaths. There are doctors saying that 3 to 4 people are dying every day compared to a normal of about 2 to 3 per week, as the Financial Times reported today. And that is of deep concern, because if that is the situation in our capital city, surely the rest of India is not better prepared than Delhi is. And you can be sure that the number of cases will go up. All the stories that were always around about BCG and temperature and what have you are hopefully out the window now, because since February or March, we've been trying to debunk these and saying we can't depend on stuff that is not science. So I think we're going to have to face the brunt of this, and I just don't see what the alternative is really going to be.
Okay, so then do you think there is any scope or any sense, and I'm not saying it's going to happen, Dr. Ramanan, but do you think there's any scope or any sense as the numbers go up? We know we are going to, we're all already sort of short on medical interventions and possibilities. Do you think it could trigger a second lockdown or policymakers to start thinking in that direction?
So I don't know what policymakers will decide, but what I do know is that if you look at the data on lockdowns by country, lockdowns are typically effective if implemented early, if your objective is to buy time, right? So that's what it really does. A lockdown at close to the peak of the epidemic doesn't do a whole lot in terms of reducing the epidemic, particularly in a country like India where the lockdown is not going to be effective. That's number one. Number two, the lockdown may actually impede people having access to healthcare, which even at the best times is challenging. But then during a lockdown, you tell people, I'm going to take away your public transport, I'm going to make it difficult for you to step out of your colony. Then people will just end up suffering at home, or, infecting people in the house or in their neighborhood. So I think from an epidemiological standpoint, it would be a bad idea to have a lockdown at a time when we're approaching the, when the cases are really climbing. And the time to have done it was the time that India did it, which is very early.
Okay, I just want to get Dhruba, your take on the narrative around the numbers right now, and this is what the government has consistently been saying. There is no community transmission. I'm not sure what the definition of community transmission is, but technically India is not seeing community transmission. Clearly, so many people who have been infected have perhaps got it from each other. I don't know. Secondly, the other narrative is that we have a large number of cases, but our recovery rate is high. Our mortality rates are, low compared to the rest of the world. Our per lakh rate of infections are very low. Do you stand by all of that? Is that how you see the data coming in, which gives a sense that it's okay, we're not doing that badly?
I don't know about community transmission for sure, right? But it comes to the recovery rate. As the disease progresses, we expect that the recovery rate will keep on going up because once you reach the peak, it means it will, if it has to turn down, which means more people are recovering than more people are getting sick. And that's when you reach a peak. However, the only good part about all this thing is the mortality rate. If reported correctly, the mortality rate is less as compared to a lot of other nations. Compared to the number of cases which we have seen. And India is a large country, right? And depending on the number of cases which we have in India, it's comparatively smaller than any other nation. But again, we are still on the rise. So till we actually reach the peak and start climbing down, it's very difficult to say whether we have done better than the other countries. As long as we can keep the mortality rate down, I believe we are in a good shape.
So, Dr. Ramanan, all of the benefits of our demography, a younger population, and all of that, do you think those benefits still show? Looking at the numbers, and of course, the big sword hanging over everyone's head is the pathetic healthcare infrastructure.
Right. So I don't think that the mortality rate age adjusted, and age adjusted means that you account for the age of our population, is actually lower. I think this is, it's a bit of a myth. I think this is, it's exactly where one would expect. And in fact, I don't know if comparison across countries is super helpful, but I don't think that our mortality rates are low, also because we're probably underreporting deaths. But to be fair, many other countries are also underreporting deaths. So I think this will be a subject to be discussed maybe 2 years from now, once we've actually counted and done this properly. I think the main point to take away here is that India has a very large population. So even small rates all translate into very large numbers. And the key thing is that we have to manage it within the scope of a health system, which is already being stretched to the limit, even though we've not got the full set of infections in already. So hopefully the measures that have been put in place during the lockdown, the railway carriages that are, that are mobile ICU beds, the excess capacity that has been created, in some stadiums and so forth. I think now is the time to really deploy these railway carriages, all of this. We need to treat now as really the point at which people desperately need the help. If people are dying outside of hospitals, it means that we're not leveraging all the help that we can actually get. If we need to get, bring in doctors from other parts to help in the places that are worst affected, now is really the time to do it.
So fair to say, Dr. Ramanan, that how we deal with the disease and the epidemic right now is crucial over the next 2-3 weeks?
I think it's crucial for the next 3 months, probably, as we get to this top of the peak and beyond. And we are fighting it very much as a state-by-state battle, which is also probably not the best way to do it, because every state is going to get affected at some point in time. There will be a point at which Bihar is going to be worse affected, but Maharashtra would have recovered already. And that would be a time for Maharashtra to be helping Bihar, or for Kerala to be helping Bihar. There is not one single epidemic. There's multiple epidemics across the country. And I think we have to see how best to deal with it in every single state, so that our focus is very, very much on reducing mortality. That's really the only thing that one should care about at this point in time.
Absolutely. Well, we'll have to hope for the best and leave the semantics of second wave, second lockdown to the experts. Let's not panic, because there's really no point of doing that. which is why it's important to hear what the experts are actually saying. Thank you so much, Dr. Ramanan. Thank you, Dhruva, for joining us today.